Right now with AI Scribe, we're looking at it from, like I said, from an evaluation point of view. So what I'm hoping is at the end, we already have a lot of lessons learned, and a lot of it is around that privacy and security, that data governance, like who owns the data, where does your transcriptions go, the recordings, that kind of piece. And I think at the end of it, what it's going to happen is, what we're hoping is we'll be able to identify the gaps and kind of say, this is where and you need to fit, like to meet it. So this is version 1, but version 2, you need to be able to do A, B, and C. And then could we develop a certification in quotes, because it's not a true certification, for AI, where there's a minimum piece that you need to meet in terms of privacy, security, what your contracts look like. And it's really kind of giving that sense of security to clinicians, to know that if they pick one that's been certified or looked at or vetted, whatever you want to call it, that the minimum's been done for them, right? We're also looking at scaling and spreading, because there's a lot of need for documentation in AI Scribe, right? Like it really does move the needle on administrative burden.
Oh,
So
hugely.
because we were like, it's amazing, right? And because we work so closely with the ministry, like if we finish these projects and we look at all like what's out there and we do an evaluation and we understand what's happening, that gives us some really good data and some kind of advocacy piece to say, listen, what if you funded AI for everyone in the province, right? What if there's one AI that could be the AI of the province, that we're able to fill in the gaps and kind of shape the way that they're going to become and meet our needs, instead of us having to decide what to buy from vendors who are meeting their needs, right? So obviously I'm generalizing, because there's a lot of great products out there, but it's just kind of, it's the idea of who's in control of the technology. Like, is it the technology that's changing us, or should we be in control of the technology so they're meeting our needs and helping us where we need it to go? And right now, there's no one, I mean, it's not like we can control AI because it's already out of the barn, but there's no one like even the like regulating it or understanding it or kind of looking at the pitfalls, so that 5 years from now, I'm not on your podcast telling you how AI has created such a burden and how my data is everywhere and now I'm liable for it and how these breaches are happening. Like, we're trying to kind of get in front of that right now.
And so earlier you mentioned that part of OMD's mandate is, the certifications and the education, but you're also acting more as like the advocacy body
Yeah.
interfacing the physicians with the technology.
Yeah.
How do you foresee that going then in terms of like the AI versus the EMR vendors? What kind of
Yeah.
direction would you like to see them take it, either from the functionality or the security or
Yeah.
operations of it?
Well, I think the issue is our certification is a very tech privacy heavy certification. It's not a functionality like number of clicks or ease of use. It's not what we call a usable type of certification, right? So I think part of our advocacy is understanding, can we make those changes and those improvements? And that's where I hope that we'll be able to do in the future, is like, okay, you've met the basics in terms of privacy and security, but why does it take me 20 clicks and 3 pop-ups to do a prescription? Could we start having some sort of rules around that? And that's what we're looking at. So in Ontario, we're also looking at what we're calling a managed health digital service, where I like to think of it as kind of a value reseller of EMR technology or technology in general, or in my brain, I think of it as a broker, right? So if you've got like in your clinic, let's say you've got 7 docs. So you go to the EMR vendor and you go, I've got 7 docs. What's the price you can give me? And how much is your AI? And can you throw in a patient portal? And you're negotiating. It's like buying a used car.
Hmm.
Everyone's negotiating individually. And some people are really good at it and some people aren't. And some people are solo. So they're not going to get as good a price if you're 20 docs. And it's all over the place, right? So what we're looking at in Ontario is, could we become that voice or that broker or that like kind of that managed digital service for EMRs and technology, to the point where we could say we've got like 2 or 3 OHTs that are interested in vendor A. So vendor A, this is what they want. This is the price they want to pay. I'm making this part up because we're still kind of looking at it, but but they also want AI scribe thrown in, and they want A, B, and C done in terms of functionality. Are you able to meet this? And so it's now we have a bit more of a voice, right? And could you imagine if this came en masse with all the docs in the community? Because now you can make those changes with the vendors that right now we can't really do. And so that's the other kind of big project that we're looking at, kind of saying, how do we make this work? OHTs, because that's kind of how Ontario is starting to be divided, are already talking about that, like, in terms of anything, like, is it IT, like computers for your clinic, for IT services for your clinic, privacy and security, like cybersecurity? Could we do it en masse? So Ontario MD is saying, yeah, we could do that. We can help you do that. And we're just trying to figure out what that would look like.
I think that makes total sense, right? Just that bargaining, negotiating
Yeah.
power that comes from working as a group together. How do you manage the heterogeneity of it though then? Because like everybody's got a different
Yeah.
EMR, everybody wants to use a different
Yeah.
tool, everybody wants a
Yeah.
EMR with the different modules added
I
onto it.
know.
How do you effectively actually take that to the bargaining table?
Yeah. So I think that's why I'm saying we're in early stages, because you're absolutely right. You put five doctors in a room and they want five different things, right? But if you put five doctors in a room who want five different things, and you've got the skills to figure out what's most important to them because they're actually going to see some benefit, maybe the three things that were the outlier is no longer important, right? So maybe we can start kind of bringing people together to say, this is what we want for this area. And these are the top five things, and everything else is just a nice to have. And could we find that nice to have in some other sort, in terms of like like a workaround, or could we use the functionality of the EMR to help you get those nice to haves, right? But what we want the vendor to do should be big picture things that actually move the needle on burden or cost, or just makes it easier for us, right? So I think I think when that I think when you kind of hold out that I don't know what the word is, but when you hold out to say there is a chance that you could actually more control over the bigger pieces and possibly save yourself some money, I think people will start to align a little bit better.
Yeah, just getting a consensus and definition around what is
Yes,
that base model package and how can we
exactly.
negotiate that for the group?
Exactly. So the community health centers, or the CHCs in Ontario, have been doing this for a while. So they've actually, so we're kind of looking at the model that they've done, where they have done this with a single vendor, saying everyone's going to be on the same EMR, and here's the functionality, and we want a discount, we want all these things done, and it's worked. Like, that's exactly what they've gotten. So it's doable. It might come with the expense that you might not get every little thing you want in your EMR, but then I think that's where you need an organization that knows how the workflow is, and maybe what you want in your EMR isn't actually that efficient. Like, maybe then it's stepping back, saying, well, instead of wanting this, maybe what you really need is this technology at the front end, so that you don't even have to do that. Like, obviously I'm kind of being very general, but that's how we would want to look at it.
Very cool. And then where do you see the AI powered tech going? Right
Yeah,
now it's very much in the scribe
it
world
is.
and making the
Yeah.
chart notes. What do you think is going to be the
Yeah.
next generation after that?
Oh my gosh, it's going to explode. Right now, AI Scribe is probably the most mature, because it doesn't require true integration into your EMR, right?
Mhm.
Because it's a standalone, it could be web based. It's a mic. It's just a mic with I mean, not just a mic, but it's a mic with a transcription that with algorithms, and then the AI behind it, right? Um, and it doesn't necessarily is integrated, so you don't necessarily have to work with the vendors. You could do it independently. And sometimes docs don't want it integrated, right? They don't want to have that huge transcription in their EMR directly, or the recording, because now you might have opened yourself up to liability on every word that's in there. Like, you probably want it separate, and then you can adjust your note and paste it in. And I think that's why AI Scribe has taken off, and it's kind of a low hanging fruit from that point of view.
Mhm.
But where we need is, I think the next step is going to be around AI assistance, like the inbox management, I think is the next spot that's going to be. But that requires more integration into your EMR and understanding the reports coming in. And there's more functionality. Then there's like the point, like the clinical decision tools, right? Like you're sitting there, and wouldn't it be lovely if you're sitting there, you see your patient with diabetes and heart disease, and you have an AI that's putting all this data into all the randomized control trials out there, and then it spits out, according to the top 3 trials, you should be considering drug A, B, and C. And you haven't actually ordered 3 of these tests that you should order now. Like that's what I would want my EMR to do, right? And kind of like the up to date in an AI version, but doing this panel analysis for me. And that's coming. So there are a few AI products out there that are actually doing that right now. So I think that's going to be big. And then the other part is AI patient management, like the triaging before they even come see you, getting the information you need, like making sure your notes are like up to date. And then the post management of patients, remote patient monitoring, the wearables, the apps, like there's so much that we can do with patients that will then take that off our plate, because they can manage that on their own with AI. And then we can just come in when we need to. Like now you're getting me all geeky excited, because now I'm thinking about the technology piece of things. But we have to be careful that we don't fragment it, right? Like, so I'm paying like vendor A for AI scribe, and now I'm paying vendor B for like inbox management. I'm paying vendor C for like, it's too much, and it's going to be very expensive for us. So I think someone needs to kind of bring it all together into one kind of roadmap and kind of say, where can this go? And I think that's what our EMR vendors are probably working on, is how do I bring it all together so I can raise the prices here, but keep this going.
I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.